What if one small handful of nuts, something you believe is healthy, was quietly damaging your heart, your brain, and your bones? Sounds unbelievable, right? But as a doctor, I've seen it more than once, and one patient changed the way I look at nuts forever. Her name was Lorraine, 72 years old, widowed, still sharp, still social, but constantly tired. She came to my clinic complaining of brain fog, joint stiffness, and a strange heaviness in her legs. No disease, no diagnosis, just a slow, steady decline. I ran blood work, checked her medication, scanned her history. Nothing explained her symptoms, until I asked her what she snacked on every day. She smiled and said proudly, "I only eat healthy nuts, almonds, cashews, peanuts, macadamia, no junk food." That's when I paused. Because after 60, your body doesn't respond the way it used to. Some foods that helped in your 40s can now quietly harm. And unfortunately, some of the most popular healthy nuts are the worst offenders, especially for older adults. A 12-year study published in the Journal of the American College of Cardiology found that certain nuts increase cardiovascular risk in seniors by up to 48%. That's not a rumor, it's peer-reviewed science. So I did what any doctor would do. I asked Lorraine to change just 2 of her daily nuts and keep everything else the same. What happened next surprised even me, but we'll get to that soon. Welcome to Health Facts. I'm Dr. James Rowan. And in today's video, we're diving into the truth about nuts and aging. I'll show you the 4 best nuts to support your brain, your bones, and your heart, and 4 common nuts that might quietly sabotage all of it. And of course, I'll share what happened to Lorraine and why that one swap made such a huge difference. If you're over 60, every bite counts. Your body becomes more responsive and more sensitive to what you eat. And that's especially true for nuts. Once hailed as universal health foods, some of them can now do more harm than good, depending on your age, digestion, and medications. That's why today's video is so important, because not all nuts are created equal, especially in the second half of life. Some nuts feed your brain, calm inflammation, support thyroid function, and help you sleep better. They're rich in healthy fats, antioxidants, and essential minerals that support strong aging. But others? They can spike your blood sugar, interfere with medications, damage your liver and kidneys, and even increase joint pain. And you'd never suspect them because they're marketed as healthy. I'll walk you through both sides, clearly and calmly. No fear tactics, just facts. We'll start with the 4 best nuts for seniors, including one that supports your thyroid with just a single bite. Then we'll look at 4 popular nuts that seem harmless, but often work against everything you've been trying to protect. This isn't a video about restriction, it's about choosing wisely, giving your body what it truly needs in this chapter of life. And along the way, I'll explain the science, share patient stories, and help you make small, powerful shifts in your daily routine. Brazil nut. One small nut that changes everything. Let's begin with the most underestimated nut of all, the Brazil nut. Small, often forgotten, but incredibly powerful. My patient Lorraine had been eating mixed nuts for years, but when we swapped her daily cashews and macadamias for just one Brazil nut each morning, everything changed. She looked at me, puzzled, and asked, "Only one?" "Yes, just one." Because Brazil nuts are the richest known food source of selenium, a trace mineral your body needs in small but vital amounts. Selenium plays 3 critical roles for seniors. It supports your thyroid, protects your nerves, and helps your cells repair from aging. Lorraine showed every sign of a sluggish thyroid, low energy, mood dips, slower metabolism. She didn't need pills, she needed selenium. Selenium helps activate thyroid hormones, which control everything from your body temperature to your weight, mood, and energy. But it doesn't stop there. Selenium also protects your nervous system by preserving myelin, the fatty insulation that helps brain signals fire fast. Without healthy myelin, you experience slower reflexes, balance issues, and even early memory loss. And here's something most people don't know. The selenium in Brazil nuts is far more bioavailable than any supplement. Your body absorbs it 3x better from food. After just 2 weeks of this small change, Lorraine told me, I feel lighter in the morning. I don't need 2 cups of coffee anymore. And at her 2-month checkup, she had lost 4 pounds, was sleeping better, and her thyroid labs had improved, without medication changes. Brazil nuts also support gut health, reduce sugar cravings, and may even slow aging by protecting your telomeres, the protective caps on your DNA. Now, one important warning, more is not better. Too much selenium can be toxic. Just 2 or more Brazil nuts a day may cause nausea, fatigue, or even nerve damage. That's why I always recommend buying them in the shell. The shell protects their oils from oxidizing and keeps them potent longer. Never buy huge pre-shelled bags. They lose freshness and potency within weeks, and can go rancid if left at room temperature. So if you're looking for one small daily habit that supports your thyroid, brain, and aging cells, start with this. 1 Brazil nut each morning. Walnut, the brain nut that protects your mind. Have you ever noticed what a walnut looks like? It's shaped just like the organ it protects, your brain. And maybe that's not just a coincidence, because among all nuts, walnuts have the strongest link to brain health, especially after age 60. Walnuts are rich in ALA, a plant-based form of omega-3 fatty acids. These healthy fats help your neurons rebuild, repair, and communicate more clearly. Your brain shrinks slowly after age 50, but the right nutrients can slow that down, even restore what's been lost. A study in the Journal of Nutrition found that seniors who ate 1.5 ounces of walnuts daily for 8 weeks improved their processing speed by 22%. That's the kind of difference you feel when talking, remembering names, or staying focused during conversations. But walnuts don't just feed your brain, they protect it. They're rich in polyphenols, antioxidants that reduce inflammation inside the brain, the kind linked to Alzheimer's and cognitive decline. Walnuts also contain melatonin, the natural sleep hormone your body produces less of after 60. 5 to 7 walnut halves before bed have helped many of my patients fall asleep faster and stay asleep longer. Sometimes I tell patients, you don't need a sleeping pill, you just need a handful of walnuts and less screen time. And the benefits don't stop there. Walnuts are a true heart-brain connection food. They contain arginine, an amino acid that relaxes blood vessels, improving blood flow to both brain and muscles. Better circulation means lower blood pressure, improved oxygen delivery, and a sharper mind. Quick tip: store walnuts in the fridge. Their delicate oils go rancid quickly at room temperature, and that bitter taste? It's a sign the fats are oxidizing. Still, a little bitterness isn't a bad thing. It often means more antioxidants, so don't let taste fool you, let science guide you. If you want to stay sharp, sleep deeper, and support your heart and brain, a handful of walnuts a day is a habit worth building. All in one small nut. Strong bones, better pressure. Now, let's talk about a nut that quietly protects 2 of the most important systems in your body, your bones and your blood vessels. The almond. Light, crunchy, familiar, but also incredibly powerful for people over 60. Just a quarter cup, about 15 to 20 almonds, gives you nearly 100 mg of calcium, your bones' first line of defense against fractures and weakness. But almonds don't just bring calcium, they bring magnesium, a mineral that acts like a traffic cop, guiding that calcium into your bones, not your arteries. And that same magnesium helps relax blood vessels, reduce blood pressure, and improve circulation, a major win for both heart and mobility. I once worked with a retired carpenter named Joe. He had stopped climbing stairs due to leg cramps and balance issues. We didn't start with medication. We started with almonds, raw, unsalted, about 20 each morning. After 3 months he was walking again, lighter, more confident. But here's something many people overlook: the skin of the almond. That's where the real magic lives. Almond skins are packed with flavonoids, plant compounds that reduce inflammation, protect brain cells, and work alongside vitamin E to double antioxidant power. Vitamin E also supports your skin, immune function, and brain, all areas that decline faster with age. Almonds are one of nature's best sources. Just be sure to eat them raw or dry roasted and skip the salted or sugar-coated kinds. Too much sodium cancels out the heart benefits. Want better bones, better blood flow, and better brain protection? Make almonds your morning habit. Pistachio, the small nut with big balance benefits. Now let's talk about a nut that's colorful, fun to eat, and quietly powerful, the pistachio. Pistachios may look like a snack, but they're a complete support system for blood pressure, eye health, and blood sugar control. Let's begin with your blood pressure. Pistachios are rich in potassium, about 285 milligrams per ounce, and very low in sodium. That potassium helps your kidneys flush out extra salt, which gently lowers systolic blood pressure without medication. In fact, several studies show that just one serving a day can reduce arterial stiffness and improve circulation in older adults. But the benefits don't stop at the heart. Pistachios are also a top source of lutein and zeaxanthin, two nutrients essential for eye health. They help protect against macular degeneration, a leading cause of vision loss in seniors. Here's an unexpected benefit: the shell of the pistachio. Why? Because shelling pistachios slows you down. That pause makes you more mindful. It's nature's built-in portion control. And for seniors trying to manage weight or blood sugar, that's a big deal. Each ounce also provides about 3 grams of fiber, which helps stabilize blood sugar, reduce spikes, and support gut health. Plus, they're soft, easy to chew, and gentle on sensitive teeth or dentures, unlike harder nuts like macadamias. So what's the best way to eat them? Try 40 pistachios in the afternoon, unsalted, in shell. That's a great snack between lunch and dinner. Remember, choose dry roasted and unsalted pistachios. The roasted and salted versions can undo the blood pressure benefits. For seniors focused on circulation, vision, digestion, and blood pressure, pistachios are a smart, colorful ally. Macadamia, elegant but dangerous after 60. Macadamia nuts, buttery. Rich, often called premium, but for older adults, macadamias can be more burden than benefit. Let's talk facts. Just 1 ounce of macadamias contains about 200 calories and over 22 grams of fat, most of it saturated. For seniors with slower metabolisms, that's a quick path to unwanted weight gain and increased LDL cholesterol. But there's another issue most people miss: the gallbladder. Saturated fats can trigger gallbladder stress or attacks, especially in seniors with silent gallstones. I remember a patient, Mr. Terrence, who came in with upper stomach pain after his afternoon snack. He'd been eating macadamias daily. His ultrasound showed inflammation caused by high-fat snacks. Once he cut out macadamias, his symptoms vanished. But that's not all. Macadamias are dense and hard, making them risky for aging teeth, implants, and dentures. Many macadamia products are also roasted in oil and loaded with salt, adding to inflammation, water retention, and high blood pressure risk. They also oxidize easily. The healthy fats inside spoil when stored at room temperature, turning rancid and damaging cells over time. And let's not forget the portion trap. Because they're smooth and tasty, they're dangerously easy to overeat. Most people don't stop at 5 or 6, they eat double without realizing, and for seniors, that's a recipe for higher LDL, belly fat, and sluggish liver. So what's the verdict? If you enjoy macadamias, treat them like a luxury, not a daily snack. 1 or 2 on special occasions, fine, but skip the daily habit, especially if you're managing cholesterol, gallbladder, or weight. There are safer, smarter nuts for everyday strength. We'll explore more of those, and which others to avoid, coming next. Pine nuts and peanuts, small, natural, but dangerous for seniors. They're small, they're natural, they're often seen in healthy diets, but for seniors, pine nuts and peanuts can do more harm than good. Let's start with pine nuts. a gourmet favorite in pesto, trail mix, and upscale salads. But they come with a strange side effect: pine mouth. Pine mouth is a bitter, metallic taste that can last days or even weeks. For older adults, that can mean loss of appetite, which leads to unintended weight loss. Worse, pine nuts interfere with up to 60% of common medications used by seniors, including statins, antidepressants, and blood pressure pills. They alter liver enzyme activity, making it harder for your body to break down medications properly, a hidden danger few people know about. On top of that, pine nuts spoil quickly. Their delicate oils oxidize easily, creating compounds that increase inflammation, especially in joints and arteries. I had a patient with arthritis who loved trail mix. After we removed pine nuts, her joint pain decreased in just 3 weeks. Coincidence? I don't think so. Now let's talk about peanuts, a staple snack for many, but one with hidden dangers, especially after 60. First, peanuts aren't true nuts. They're legumes that grow underground in moist soil, which makes them prone to aflatoxins, mold toxins linked to liver damage and cancer. Even without an allergy, peanuts can trigger systemic inflammation, worsening joint pain, brain fog, and cardiovascular stress. They also contain high amounts of omega-6 fatty acids, which disrupt the omega balance in seniors and increase inflammation further. For those on blood thinners like warfarin, peanuts are particularly risky. They contain vitamin K, which can interfere with medication, increasing clotting or bleeding risks. What about peanut butter? Most brands are loaded with hydrogenated oils, sugar, and salt. Even the natural ones can pack in too much sodium. It's also dangerously easy to overeat. A couple of spoonfuls can contain 200–300 calories without making you feel full, a slippery slope for weight gain. So what's the advice? If you're over 60, limit both pine nuts and peanuts. Don't be fooled by the natural label. Focus on what supports your body, not what sneaks in harm. Your heart, your liver, your medications, they all work better without these two in your daily routine. Cashew, smooth, sweet but a hidden trap for seniors use. Soft, creamy, sweet. They taste like dessert, and many people believe they're the healthiest nut of all. But for seniors, cashews come with a long list of hidden risks, especially for blood sugar, bones, and kidneys. First, let's talk carbs. Unlike most nuts, cashews are high in carbohydrates, about 9 grams per ounce, and very low in fiber. That combination leads to blood sugar spikes, followed by energy crashes, a serious issue for older adults managing prediabetes or type 2 diabetes. I had a patient, Mrs. O'Hara, who ate cashews daily, thinking they were better than cookies, but she always felt drained after lunch. When we removed cashews from her routine, her afternoon energy returned, and her blood sugar stabilized within weeks. Now here's another hidden danger: oxalates. Cashews are high in these compounds, which bind to calcium and prevent its absorption. For seniors at risk for osteoporosis, this can quietly reduce bone density over time. It also increases the risk of kidney stones, especially for those with reduced kidney function. And here's a fact most people don't know. Raw cashews are toxic. They contain urushiol, the same chemical found in poison ivy. That's why cashews must be steamed or roasted before being sold. But even then, many commercial cashews are roasted in oil and heavily salted. And they're easy to overeat. Their soft texture and mild flavor make them one of the most commonly overconsumed nuts. Cashews also contain enzyme inhibitors that make it harder for your body to digest and absorb protein. Over time, that can contribute to muscle loss and fatigue. So what's the verdict? Cashews are not a daily nut for seniors. They're okay as an occasional treat, but not as part of your everyday snack habit. If you want stable energy, better bones, and healthy kidneys, choose almonds or walnuts instead. Cashews may look friendly, but they don't age well with you. So now we've reached the end, but really, this is the beginning of something better. We've explored 4 nuts that help you age stronger and 4 that quietly work against your health. Let's recap. Brazil nuts for thyroid, nerves, and cell repair. Walnuts for memory, sleep, and circulation. Almonds for bones, blood pressure, and brain protection. Pistachios for eyes, digestion, and potassium balance. Now the ones to limit or avoid. Macadamia, too much fat, hard on teeth and gallbladder. Pine nuts, trigger bitter taste, spoil fast, interfere with meds. Peanuts, high inflammation, liver risk, omega imbalance. Cashews, spike blood sugar, block calcium, overeat easily. Each of these choices may seem small, but over time they shape your energy, clarity, and confidence. I've seen patients regain strength, stability, and even joy, not with pills, but with one small shift in what they eat every day. Because the truth is, your body after 60 is more responsive, more sensitive, and more deserving of foods that heal, not harm. So I'll ask you again, which nut will you add this week? Which one will you finally let go? If this video helped you see things differently, hit the like button, share it with someone you care about, and subscribe to Health Facts for more guidance on aging with wisdom, not fear. I'm Dr. James Rowan, and I believe your best years are still ahead if you feed them right.